Welcome back to part 2 in a 3-part series on rehab exercises after breast cancer surgery. This video covers weeks 3 to 6 after surgery. This is the program that I did after my double mastectomy, and then I did it again after my reconstruction surgery. This is also the program of exercises that I prescribe to my own patients who've undergone breast cancer surgery. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. What equipment will you need for this stage? Just a little bit of wall space, that's it. These exercises build on the first series of exercises. So if you haven't watched that video first, that's a good place to start. If there are any exercises that are still challenging from that first series, I would continue to do them during this stage. For example, the arm lift exercise is usually one that would be helpful to keep in the program. Lifting your arms up to the front really tugs at that underarm area, and when lymph nodes are removed, there's even more tension in that area. Just like the first stage, I could do slightly more after my reconstruction surgery than I could after my mastectomy surgery. So I did do some of these exercises a little bit earlier after that second surgery. Goals for this stage are to further increase your range of motion compared to the first stage, so you're just progressing that week to week. There's more of an emphasis on strength and stability during this stage, so eventually when you want to do some bigger movements like pressing overhead, pushing in front of you, or pulling, you want some of those smaller muscles, especially around the shoulder blades, to be stable to support those motions. Improve posture. There's a tendency after breast cancer surgery to be a bit rolled forward, so these exercises will help roll the shoulders back and strengthen the muscles that help to support that motion. And finally, reducing the side effects of cording and lymphedema, as movement will help both of these conditions. How often do you need to do these exercises? About 2 to 3 times per day, one set of 5 to 10 repetitions, depending on the exercise. There are 6 exercises in total for this stage. The first exercise is elbow pushback. You're going to place your fingers on the back of your head, and the fingers do not need to be interlocked. Move your elbows back by squeezing the muscles in between your shoulder blades. When you feel a stretch in your chest but no pain, hold for 5 seconds. This is going to feel quite tight at the beginning. When you draw that elbow back, it really tugs on the chest area and opens that area up, and it also tractions the underarm area. So with lymph node removal, there's going to be an extra sensitivity and tension in that area. The second exercise is shoulder circles. You're going to start with your arms at your side. Slowly, you're going to raise your arms up to the front, out to the side, then to the back, ending up with your arms by your side again. So this would be a backward circle. Once you complete the number of repetitions backwards, you can do the same number of repetitions forward. There's a tendency to raise the shoulder up as you're doing this exercise, so do your best to try to keep it down throughout this movement. Your range of motion with this will be pretty small at the beginning, and as you progress week to week, you'll be able to do larger circles. The third exercise is wall walks. There's 2 versions of wall walks. The first one is moving your arm up to the front, and then the next one will be moving the arm out to the side. So you're going to stand facing the wall and place your hand on the wall at about waist level, and then you're going to start walking your arm up the wall till the maximum height where you feel a stretch but not pain. You can hold here for about 10 seconds or 3 deep breaths at the top, and then slowly lower your arm down and then repeat. As you improve, you can move your feet slightly in closer towards the wall so that you can move your arm up the wall a little bit further. To track your progress, you can make your way up the wall, and when you reach that maximum height, put a piece of painter's tape there, come back down, and then each day when you're doing this, or week by week, you can track your progress to see how much higher you can go compared to that first tape mark. There's a tendency with this exercise to bend your arms as you're raising it up the wall. So you want to try to keep your arms straight throughout this whole movement. The fourth exercise is wall walks to the side this time. So you're going to stand perpendicular to the wall, have your hand on the wall at about waist height, and slowly walk your fingers up the wall until you feel a stretch but no pain. You can hold here about 10 seconds or 3 deep breaths at the top, and then slowly lower your arm down and then repeat for the number of repetitions. Just like the previous exercise, as you get a bit better in terms of your range of motion, you can slowly move inward towards the wall so you'll be able to raise your arm a little bit higher. You can track your progress on this exercise just like the last one. So when you're at your maximum height, put a piece of painter's tape there and then track week by week to see how much higher you're able to get. There's a tendency to raise the shoulder up as you're doing this exercise, so do your best to try to keep it down throughout this movement. If keeping the shoulder down means you can't raise your arm as high, that's okay because that's your actual range of motion. There's also a tendency to have that arm migrate a little bit forward on the wall, so do your best to try to keep your arm in line with the rest of your body at your side. The fifth exercise is a forward lift. You can use a broomstick at home, or even a belt will do if you just sort of tug tightly as you're doing the exercise. Start by lying on your back with the broomstick resting against your thighs, and your arms are going to be straight. Lift the broomstick towards your head until you feel a gentle stretch, but no pain. You can hold about 10 seconds or 3 deep breaths at the top, and then gently lower your arms to the start position. With a one-sided mastectomy, you can actually use the unaffected arm to help the affected arm with a bit more range of motion. This was the only exercise I omitted during this stage. I had tissue expanders and then implants placed under the muscle, and there's quite a bit of activation of pec as you're doing this exercise, so I just found that at this stage it felt a little too early to be doing it as it didn't feel comfortable. If you had a mastectomy with flat closure or tissue expanders or implants placed in front of the muscle, this should be fine to do for you. If your tissue expanders or implants were placed under the muscle like mine, I would still encourage you to try this exercise and see how it feels for you. Everyone's body responds differently even when you have the same surgery. We've got one more exercise left. If this video has been helpful to you so far, hit that subscribe button down below for more content just like this. The sixth and final exercise is called back climb. You're going to slowly slide your hand up the center of your back as far as you can. You can hold for 10 seconds at the top or 3 deep breaths, and then slowly lower your hand back down and then repeat for the number of repetitions. This is an important movement that's often neglected. We tend to focus much more on, let's say, raising our arm to the front or out to the side, but there's much less focus on that shoulder motion with the hand going behind the back. Why does this matter? Because having good range of motion in all directions of the shoulder will result in a better functioning shoulder overall. At the initial stages after surgery, we're most often wearing front closure bras, so we aren't really reaching behind our back to do up a bra like we normally would, and you might not even know that this range of motion is limited. There's a tendency with this exercise to have that shoulder roll forward as your hand is climbing up your back. So really try to pull that shoulder blade back and down to keep it in position as you're doing this exercise. Here's a summary of all of the exercises for this stage. You can take a screenshot to have this as a convenient reference for you to look at as you're doing the exercises going forward. If you're past the 6-week mark after surgery, this next video covers the rehab exercises for 6 weeks and beyond. We'll see you in the next video.